Welcome back to CT Live. The mission of the STEP Learning Collaborative is to help teens and young adults connect to early treatment for psychosis. And here to tell us how the program works and its collaboration with first responders are clinical social worker Carrie Veillette, and of course we have New Haven Police Captain Mike Fumiatti. Thanks so much for hanging out with us today. So can you tell me a little bit about STEP and how it works?
Sure. The STEP Learning Collaborative is a statewide initiative targeting young adults between the ages of 16 to 35 who are experiencing a first episode of psychosis. We know that there are going to be about 500 new cases of a first episode psychosis across the state each year. So it's important for us to disseminate the information about early intervention, the importance of treatment, the effectiveness of treatment. And so we're really excited to have had this opportunity over the last year and a half and continue that in disseminating the importance of this initiative.
Okay, and in doing so, how are you guys working in step with emergency services?
Sure, yeah, it's a good question. So usually it is not uncommon for the young adults in the community to intervene with the law enforcement, mobile crisis clinicians, AMR, as kind of their first line of getting into care. So it was important that we connected with the New Haven PD, other PDs across the state to teach them about early psychosis, what that looks like when they're on a crisis call, and then disseminating to them the information to help these individuals get connected to care. It is always our goal to try to avoid a hospitalization if not necessary. And so by educating police how to show up to a scene that may have better communication skills with this young person, it is hopefully our goal to get those individuals connected to effective treatment as soon as possible. It doesn't always necessarily mean the hospital.
Yeah, so I'm glad you mentioned New Haven specifically. Of course, we have Captain Mike Fumiatti. What does crisis intervention and response look like from your end?
There's a lot of different things across the state, how officers respond to crisis. A lot of towns and cities, the police are the crisis responders. They'll be the mental health first responders as well. And so in New Haven, we're lucky enough to have a number of different programs that will work together and collaborate around interacting with people in crisis and then transitioning them to treatment care afterwards. And so the STEP being one of those things as well. Across the state, it looks different in each town. So I also work as a co-director for CABLE, the Connecticut Alliance to Benefit Law Enforcement, and that agency does all of the crisis intervention team training for officers across the state of Connecticut, and that's been around for 20 plus years. And so it's a natural partnership between STEP and CABLE, doing the education for officers around what psychosis looks like, how people might react, what a person would look like the first time they're having it. Obviously, there's going to be a lot of fear there, a lot of confusion, and so families will have a hard time with that as well. If the officers are prepared for that, they go into it, they've dealt with it before, they recognize it, and then they can plug people into resources afterwards, then we can have some better long-term outcomes.
Yeah, absolutely, and supporting both the individual and the family around them is so important. Are there any final thoughts for our viewers regarding this topic? They may not be familiar with it, so what's the take-home?
Sure, just, being aware of the referral line that we have across the state, and with that referral line being able to have confidence that they are accessing effective, quick treatment for their loved one in a more localized area to them, given it is a statewide initiative and the STEP program is not able to target everybody kind of in their catchment area. And so the referral line is connecting individuals across the state.
Okay, perfect. A whole statewide effort. And both of you, thanks so much for joining us. We'll be back with more on CT Live.